Radio 96.1 FM, and this program is brought to you courtesy Lagos State Blood Transfusion Services. My name is Dele Agadumo, and today on the program we have the Executive Director, Dr. Bodunrin Osikomaya, gracing our studio again today. Good evening, welcome again.
Thank you very, very much.
All right, and also we have the head of programs, Mr. Oluwole, Olatubi, also on the program. Good evening.
Yeah, good evening, ma. Thanks for having us on the program today.
So Olatubi, what happened now? Your voice is not up there today. What happened? What's going on?
It's the weather.
It's the weather. Which one? The sunny one. All right, today on the program we're discussing blood transfusion safety. And so we'll be asking and answering some questions today on blood transfusion safety. So let me begin by asking the Dr. Bodunrin, what is blood transfusion safety and what are its objectives?
Thank you for answering this question, and I was wondering why Mr. Olatubi decided to ensure that we talk about this now, but it's coming in at the right time anyway. So blood transfusion safety are all activities, all measures, protocols put into place to ensure that every unit of blood is safe for those that require it for transfusion. And when we look at that, it does not just involve the person receiving the blood. So the objectives are, first of all, where the blood is coming from. We need to ensure that the donor is safe and that the person receiving it. So the objective starts from the donor, as I said earlier. Is the donor okay? Is the donor eligible to donate blood? As in donors being well reviewed, so that we will know if there are any underlying clinical conditions. Does the donor have enough blood? So would have checked the hemoglobin level.
All right.
Is the donor also having any form of mental issues too? Because we'll talk, we will review, we will see if there's anything, are there anxiety issues there.
Right.
So it's not just the clinical one, we also try to just talk to see if there are other underlying mental states, because it's supposed to be voluntary. So if there are other underlying conditions, then it starts to come in voluntary. For the recipient, that is the person that needs the blood, we will ensure that the blood is free from transmission-transmitted infectious agents. That is HIV, hepatitis B, hepatitis C, as well as syphilis. We'll also ensure that the blood is grouped and cut-matched, and that is what we call the compatibility test. Apart from those two things, we ensure that the blood is well stored, because you could have a unit of blood that is well cross-matched and compatible and does not have any infectious agent that will still be unsafe, and that is where the place of storage of the blood. So we want to be sure that the blood is in cold chain from the time it has been collected till the time the blood is transfused. Above all, too, we want to ensure that there is proper documentation, because if the blood is not well documented, then you can predispose the recipient to different form of harm. And finally, we want to be sure that every form of regulatory activities upon it has been well done, and it has passed the test of it has been certified safe to be transfused.
So aside from this objective, it means that there are protocols in place to match a donor with a recipient.
Yes. So every activity that we do with respect to blood safety is based on a protocol or guideline, and all these protocols and guidelines also they have the foundations from the World Health Organization or from organizations like African Society of Blood Transfusion or the International Society of Blood Transfusion. So we just don't take them up. We receive those protocols from these three organizations and adapt them to the activities that we do at the blood transfusion service. So with respect to matching the donor and the recipient, the first one is the compatibility test. So now we're not just talking about receiving it. We want to match to be sure that the person doing the blood from the donor is exactly what the recipient needs. So we want to do the compatibility test. Is the blood group compatible? Is the blood compatible? We want to do a blood grouping too. Usually the first stage of this compatibility test is the blood grouping. Is it A for A? Is the person a blood group A? Is it a blood group B? Is it a blood group AB? Is it a blood group O? We want to ensure that the result is also compatible with the person that needs it. And above all this too, with respect to matching it, there's the role of documentation. Studies have the highest cause of adverse reactions in blood transfusion is poor documentation. So there could be typographical errors. The scientist or the technician or the medical doctor working on these units of blood has done a wonderful job. But it's time for us to document. I know we do a lot of paperwork, and then you write, instead of writing, for example, want to write AB, just forget to write the big component and just write blood group A. You want to write resource negative, and maybe you are gisting, just turn negative to positive. So typographical errors are really, really a high cause of adverse events in blood transfusion. So the documentation of that unit of blood is really, really important. On the what to, we need to ensure that they are matched. And what is there? We need to use patient identifiers. So we must confirm the documentation by looking at patient identifiers. Okay, what is the name of this person? This person's name is Osikomaya B. Are you sure that that B is actually Bodunrin, or that B is Bayo, or that B is Bola? Because people might bear the same. So we must use two names as patient identifiers. You must look at the sex and make sure that the name of the person tallies with the sex or the gender. Is the person a male? Is the person a female? You want to also use identifiers like the age, identifiers like the hospital number, the laboratory number, and the ward of the patient. So these are multiple identifiers. To make sure that the person who needs the blood actually gets it. Even though we have those identifiers, there is a rule that 2 healthcare personnel must ensure that those identifiers are there. So we have the doctors looking at the identifiers. Oh, this person is Osikomaya Bodunrin. She is 40 plus years old. She is a male. She's a female. You know, things like that. And then we have the nurse also confirming it so that there is no mistake. So those are really, really important ways of ensuring that the blood from the donor is matched with the blood of the recipients.
That's really a long process, a painstaking process.
Yes, the painstaking process is not very long because once you know what to do, you're able to identify, because we do all these things during emergencies too. And and you just keep doing it. Once you keep doing it, you know what to do, and it looks like it's shorter by the time you know what you're doing.
So, say for instance, I mean, an emergency situation or a trauma situation, how then do you inform a recipient of the potential risks involved in transfusion, having to go through all of these protocols? How do you inform that recipient of potential risks?
Nobody must receive a unit of blood without being counseled. So it must be counseled. Maybe the patient directly, if the patient is aware enough of his or her environment, and if the patient is not very aware, you must counsel and talk to the patient's relatives. So the first thing you want to do is to tell them why you need the blood. You know, I don't know why I need the blood. You want to give me blood. It's like you're forcing it. You must tell that patient why he or she needs the blood. And then you must also tell the patient where the blood is coming from. And then you must also tell the patient the potential benefits of that blood transfusion. Oh, you are feeling very ill now. Once you have this, you need this blood because you don't have enough blood. Once you have the blood, these symptoms that you have been having, you will not have them again. Once you have the blood, we have done a test for you because your blood is also low. We expect that there should be an increase in your blood level. So those are some of the things you want to, the counseling takes, you say a lot of things, apart from the fact that you want to tell them about the benefits of having that blood transfusion. You must let them know about the number of times they need to be transfused with blood. Sometimes you need to give them more than 1 unit. You might need to give them 2, you might need to give them 3, and from there you must continue by letting them know that, okay, if you do not want blood, is there an alternative to it? Is there, there's no alternative. Some people might tell you that they don't want to have the blood for different reasons. So you need to also communicate with that donor, the recipient, to know why they might be reluctant to having the blood and why some possible alternatives may not be there for them. And you go on to let them know about the risks. So they must first know about the benefits. You don't want to scare them away. You know, tell them the reason why they need the blood, then the benefits of having this blood transfusion, and then you finally tell them the risks of this blood transfusion. And all the risks are all encompassed in what we call the adverse events of blood transfusion. So the first one we really like to tell them is, okay, if you have this blood, you might have some difference in the way you feel. You might have fever, and if you have fever, please let us know even before you have the fever. fever, the nurses will be reviewing and checking you up. You might have chills. Those are very, very common blood transfusion reactions. We also let them know about the more common ones, like you might feel pain at the site of transfusion, and at that time you might have a feeling like something bad will happen. It's very common in when you have the ABO incompatible donations. You might have abdominal pain. So if you feel different all of a sudden compared to the way you feel now, kindly let us know. And we also need to reassure them that even before they tell us that, the nurses will be reviewing them regularly. And if you notice any other thing, that we would also let them understand that there's something wrong. We don't just stop at the immediate symptoms that they might feel. We let them know that, oh, on the long run, it's possible that there could be an infection thereafter. And that is why we need to be sure that you need blood. But let them know that even though we use a 4th generation ELISA, which ensures that the blood is safe 99.77%, there's still a very, very tiny possibility of having a transfusion, an infection following transfusions. And so we let them know all these things, and we tell them even that even after the transfusion, if they notice anything that is untoward and they've not noticed before, they should hurry to let the healthcare personnel know about it. So those are how we, and it's after you do all this counseling that there is a consent. So the consent can be verbal. Most of the time, doctors rely on verbal consent. We've had webinars where we've told healthcare personnel, especially the heads of hospitals, that they should ensure that a written consent is given. For each transfusion, might not be able to give consent, but if, for example, you're managing someone with chronic renal failure that needs to have regular transfusion, you can have that consent once a year. But the commonest consent for blood transfusion reactions are verbal consent. We talk to them and they say, okay, I'm willing to get transfused. Understand? So if it is a recurrent transfusion, it is advisable that you have a written consent for people that have that need chronic blood transfusions.
Wow. Okay. So during this period, what monitoring occurs during and after transfusion to detect and manage those adverse reactions you talked about? And then in a situation where there is an adverse reaction, what procedures are put in place for reporting and investigating?
So really, the monitoring starts even before transfusion. So the questions will be what measures are put in place even before you get transfusion. So really, you must have a baseline, because if you don't have a baseline monitoring, you will not know when there's an abnormality when the blood transfusion comes in. So before the transfusion, once the patient is ready to be transfused, the nurses would have had a baseline. We want to take the temperature, we want to check the pulse, we want to check the blood pressure, we'll ask for their general well-being. How are you feeling? Is there anything wrong? I hope you are not nauseous. Is it that, do you have any parts of your body aching you? Do you have any parts of your body itching you? So we want to know the baseline state of patients, and then we begin transfusion. The first 15 minutes of transfusion is really, really important. There's a rule of thumb that says in the first 5 minutes, you monitor the patient every 60 seconds. In the second,
so the first 5 minutes, you have to monitor
just keep monitoring the patient
every minute.
Yes, you have the patient's bedside. In the first 15 minutes, you monitor the patient every 5 minutes. So after that, you can do every 5, because the commonest, as in the most fatal blood transfusion reactions occur in the first 15 minutes.
I see.
The most fatal, even before the patient is able to voice out, and you will notice it in the clinical features. You notice that the temperature is suddenly rising. You notice that the pulse is suddenly rising. Understand? So those periods are really critical to us, for us to be able to detect any form of adverse blood transfusion reaction. So in the second 15 minutes, in the second 30 minutes, so in the first 15 minutes, you are doing it every 60 seconds, every 5 minutes, and then the second in the next 30 minutes, you review the patient every 15 minutes, and then the next 1 hour, you review the patient every 30 minutes, and thereafter every hour, because by the time you have reviewed the patient and he or she is fine within the first 15 minutes to 30 minutes, then you are sure that there will be really no untoward events during that period. And after the blood transfusion, we do not leave our patients. The next 5 minutes after transfusion, we want to talk to the patient. We want to ensure that the patient is fine. Is there any nausea? And then 30 to 1 hour, you must be sure that the patient is fine. So patients will just have blood transfusion and we tell them to go away like that. Especially people that come for daycare cases. So we have people that can just walk into the clinic to be transfused. We keep them in for another 30 minutes to 1 hour to be sure that there is no other symptoms that will come up after transfusion.
Quick question. Now, I'm wondering why, if all screening tests has been carried out on the donor and the recipient, why is it that such issues or cases of a recipient not accepting the transfusion, probably within the first 15 minutes, why does it occur? Is it that is it because of the introduction of foreign quote-unquote blood makeup that causes that?
So one of the protocols that I did not mention are protocols on extended red cell phenotyping. We have protocols on extended red cell phenotyping for multiply transfused people. So the more you get transfused, the more your body is exposed to unneeded antibodies. So for people like that, they might have antibodies developed in them. Antibodies that are not like the normal A, B, and O. So such units of blood could have maybe KEL, and the patient has anti-KEL or anti-KID. We have DOFI. We have different types that could cause such transfusion reactions. So we always say that if a patient is multiply transfused, has been transfused multiple times, has had more than 5 or 6 units of blood, please go a step further to have an extended red cell typing. Also, there's something called white cells in blood. I'm sure we've talked about that.
We have.
So white cells, when white cells are kept in blood, as in the blood bag, and are not removed, they tend to form something called cytokines. So the white cells. So before the white cells eventually die out, they form some chemicals called cytokines. So cytokines, by the time it is transfused in a person, it can cause the person to have chills. So it's not like it is not compatible. But the problem is that unit of blood has been stored with some white cells that could cause all those things. So such cases like that, we stop for a while, might give paracetamol and give the blood slowly. So that the body is be able to process the cytokines already in the blood bags there. Also, we have people that, apart from the fact that they could have antibodies that were not routinely checked for, or they could have issues like the white cells giving cytokines. People also have anxiety. They want to be transfused with blood. There's a lot of anxiety, and you're like, I still have some of my patients that no matter how much they've been transfused, once it comes to having the next units of blood, they just go into anxiety. It is not really palatable to want to have blood. They do not like it. There is nothing you can do. So we just kind of distract them, tell them to come to the blood to the clinic with earphones, with films, so something to distract them so that they do not really think about it. So those are really the major ones. And we've had a case too that I will tell you about, transfusion of cold blood. So we've had cases like that. They get the blood, you're in an emergency, blood must be in cold chain, and you transfuse cold blood into someone. What will happen? The person will feel chills. It's like you're taking cold water in a cold day. How do you feel? You just suddenly feel cold. Same thing with when you're taking tea on a warm day, you feel hot. So it happens with blood too. If blood is transfused in its cold form, there's a tendency for the person to feel chills. There's a tendency for the person to shiver. And all of those things are not because of the poor compatibility. And lastly, some people can have allergic blood reactions. They're just allergic to components in blood. Some people might be allergic to the anticoagulants in the blood. And some people might be allergic to immunoglobulin. So those that have something called immunoglobulin A's and deficiencies, they could be allergic to blood, and it is because of the components of the blood. So such people too, we do some protocols for them. We wash the blood before we transfuse the blood to them. I also remember that you asked me a question on reporting of blood transfusion
investigating and reporting.
And investigating. Once there is a blood transfusion reaction, the most important thing is identification. The nurses, and that is why they must continue to be by the patient's bedside. So you identify is the nurses are usually very good at identifying when there's a blood transfusion reaction. They also inform the doctors. The two of them decide. They will document it. It has to be documented that we have noticed these following symptoms. The blood must be stopped until you prove that it is not a blood transfusion reaction or it is a blood transfusion reaction. Samples are sent to the laboratory. We also inform them at the lab that, oh, we have experienced this, and we must also inform the blood transfusion committee chairman. So every hospital that transfuses blood must have a blood transfusion committee, or they must also have an hemovigilance committee. Hemovigilance is a team that monitors the activities about blood. You must ensure that there's blood safety. So once the blood gets to the lab, they repeat all these investigations that we've talked about, the grouping, the compatibility test. You want to so see if there are signs of blood transfusion, like if there is, so if the blood cells are broken, we call it lysis. I want to see if it has affected the kidneys. So we check all those things, and everything must be documented in a blood transfusion report form. And then thereafter, it must be sent back to the hospital blood transfusion committee to know if there is a problem and to know if they have to report immediately to the blood transfusion service, because there are times when we need to take immediate measures. And for whatever has happened, at the end of the day, there's usually a training to prevent such happening in future.
Thank you so much for answering all of the barrage of questions that I have been throwing at you. Well, for those of you who are still on the road, due to the expansion joint repairs on Odoyalaro Bridge, we'll have a very, very slow vehicular movement. Those who are moving from Ketu inward Odoyalaro Bridge, they are experiencing that right now. And we also have very high influx and slow-moving traffic. Those who are coming from Third Mainland Bridge, Oworo, inward Alapere, it's also experiencing a slow movement at this time. All right, let me move over to the head of programs. Yes, how do blood banks ensure that donor consent is informed and voluntary, and how do blood banks ensure that donor consent is informed and voluntary? One, and then what measures are taken to address and prevent blood shortages, especially in emergencies or trauma situations?
Thank you for that question, Dele. So, with the Lagos State Blood Transfusion Services, we deal with voluntary blood donors.
Yes.
So that means we're expected to come voluntarily to come and donate your blood. So with that,
not forced.
Not forced. Thank you very much. So with that, we expect you to give us your consent for us to draw blood out of you. And that is why it's very important you are 18 years, because that's the age of consent. That's why we don't. That's why when you walk into the blood bank, any of our blood banks, that is why we have a donor registration form, where your biodata will be collected, which one of them is the age. Because consent is very
between 18 and 65.
Yes. And it's very important that you know that you can always withdraw your consent during the anytime during the process. That's the idea of consent. It's your consent. The same way you've given it, the same way you can withdraw it at any time. It's very important that you understand that. So about it being informed. So we have pre-donor counseling, where we have trained staff that will take you through the process. The entire process of the voluntary blood donation, the benefits, and then the risks. Make you understand the benefits, the risk, and the process. So that we're able to make an informed decision of whether to go ahead. Of course, as Madam mentioned earlier on, there may be some anxiety. We would let you understand there will be some anxiety because something that you've not, your body is taking in. Your body is, for example, the needle. People have this needle fright and things like that. Exactly. So all of these things will be explained. So just a prick here, that sort of thing. The process can take maybe about 5-7 minutes. Oh, you have to fill this form. So because we want to know your lifestyle, you have to do this. So everything that has to be done is explained to you. Yes. And then the second question you asked about
measures taken to address and prevent blood shortage, especially
during the media. So let me always start from home, and home seems to be here. So that's why we're on air tell people to come, encourage people to come forward, that we need them to come forward. So those are part of the measures that we take to ensure that we always have a steady supply of blood in our blood banks. Another thing is we have an inventory management system where we look at the demand for the blood and the supply. So anytime we're looking at, and which, because the demand is always
very high,
high, always outstripping. So we always see us every time going out to do blood drives.
Okay.
We have a donor retention system where we're able to retain our donors, our existing donors. So we have this software essentially that gets in touch with you, reminds you of your next donation date, greets you on your birthdays, informs you of our programs, because I told you about the community that we've been building. So of course we also provide some form of when you come to donate your blood, we'll give you some refreshments and some some souvenirs. So these are the things that we do to make sure that we
have a constant supply
of blood. So you also go on blood donation drives where we go to organizations, we go to churches and go there to go and ensure that we go to do advocacy for them, and the whole idea is just to increase the net of voluntary blood donors. Thank you very much.
Thank you so much. Time. Thank you so much. Thank you also to the Executive Secretary for being on the program. Always a pleasure to have you in the studio. All right, so that's our package today on Safe Blood Arena on Lagos Traffic Radio 96.1 FM. We've been talking about blood transfusion safety, and I've had Dr. Bodunrin Osikomaya, the Executive Secretary, Lagos Blood Transfusion Services, and also Mr. Oluwole Olatubi, Program Head, LSBTS, in the studio. Thank you again for being on the program. Now, if you'd like to get in touch with LSBTS, their Facebook page is Lagos Blood Transfusion. Again, Lagos Blood Transfusion. On Instagram, they are at Lagos State Blood Transfusion. Again, on Instagram, Lagos State Blood Transfusion. And on X, it's Lagos BTS. While the telephone number is 0806 920 7914. Again, 0806 920 7914. Big thanks to all of the staff at LSBTS. Thank you again. My name is Dele Agadumo, executive producer Tayo Akole, and also big thanks goes to Victor Oteri. Safe Blood Arena comes your way Mondays at 4:30 p.m. on Lagos Traffic Radio 96.1 FM.